Hello, I'm Dr. Rohini. Today I'm going to talk about a condition called short cervix that happens in pregnancy, and I'm also going to tell you how we are going to monitor a pregnant woman with short cervix and how we are going to treat her. So to begin with, it's important to know what is cervix. Cervix is a part of the uterus. It's the mouth of the uterus and it supports the uterus as it grows and advances in size as the baby grows bigger during the pregnancy. Now, what will happen when the cervix becomes short? What we are worried about? So, what basically happens is when the cervix becomes short, as it supports the growing uterus, it keeps getting shorter and shorter, and it starts opening up, and through that the bag of membranes can break. The water surrounding the baby might come out, and sometimes the patient may go into labor too early before time and deliver the baby. And this kind of baby will require NICU care, requires admissions, and in case if it's too early, that is before 24 weeks, then the baby will not even survive. So it's very important that we do monitor the length of the cervix during pregnancy when the patient goes for an ultrasound. And in case if the cervix is shortened, then we have to keep a close watch on the patient and manage her accordingly. How do we know that patient has short cervix? One important thing is we have to take a proper history from the patient, because that gives us a strong suspicion who are the patients who may land up in these conditions. So one is in case a patient has had previously same history, short cervix, and the baby delivering before time, that is before 34 weeks, pregnancy loss in the second trimester, that is after 3 months. So these kind of histories, or in case the patient has had any surgery of the cervix, like any cervical biopsy or any other procedure like LEDs, and in case if there is any difference in the shape of the uterus or uterine anomalies like uterine septum, the history is very important. That itself gives us an idea that patient may land up with this condition. Now, why does the cervix shorten? What is the cause? Some people have a inherent weakness in the cervix. The muscles of the cervix are short, so because of that, repeatedly the length reduces. Another very important reason is infection. Infection contributes to this shortening. So it's important that we keep a close watch on the pregnancy in case if you have a lot of white discharge, or if you have any urinary infection during pregnancy, that may also contribute to this. Next, how are we going to diagnose this condition? So usually diagnosis is scan based when we do an ultrasound from 3 months onwards, along with the baby's heart rate, baby's size, baby's weight, and the water surrounding the baby. It's important to see the size of the cervix also. Now, especially we keep a close monitoring on patients who have had this similar history in the past. So next is that now we have diagnosed that a patient is having a short cervix. So the criteria is the cervical length should be less than 2.5 centimeter on scan, but the moment it's between 2.5 to 3 itself, we start keeping a close surveillance. So next, how are we going to treat this patient? So first of all, we have to find out what is the cause. Why did the cervix shorten? So for that, we will be doing some investigations. We will be doing a complete blood count, a WBC, that is the white blood counts, which denote that there is infection if that is increased, and then another blood marker called C-reactive protein, that is CRP, if that is increased. In case there is any sign of infection, we would be starting patient on antibiotics. Other than that, we would be doing a speculum examination, and we would be seeing the cervix directly and see if there is any sign of infection, there is any white discharge. In that case, we would be taking a swab and we would be sending it for culture and sensitivity to find out what kind of organism is causing this infection. So after this, what is the definitive treatment? So the definitive treatment is that we would be doing a small procedure called as putting a cervical stitch. It can be there are different types of procedures like McDonald stitch, Shirodker stitch. There's also a procedure called abdominal cervical stitch. We do in this procedure is this can be done as an OPD procedure also. So the patient would be given sedation, and this sedation will not affect the baby in any kind of way. And we would be putting a small stitch around the cervix, a purse string kind of stitch, and we will be tightening the cervix. So there will be an additional support to the cervix. After the procedure, we would be giving antibiotics to the patient, and also the patient would be advised to have rest and to avoid exertion. And then we would be calling her frequently, maybe once in 2 weeks or once in 4 weeks, to see if there is to rule out any infection. And also we would be monitoring the size of the cervix accordingly. Now, when would the stitch removed? So the stitch would be removed at the time of your delivery, or just before that, and it's a very small procedure. You would not be requiring any anesthesia for that. It is also done as a OPD procedure. After the removal of the stitch, the patient, depending on her condition, she can go for either vaginal delivery or cesarean section. And once you've had this history of short cervix in your present pregnancy, it puts you at risk of getting this condition again in your subsequent pregnancies. So it's very important that even in your next pregnancy, you tell your gynecologist about this, and you inform about this history, and a close monitoring should be kept in the next pregnancy as well. Now, what are some of the complications because of the procedure? So because of the procedure, you may expect some bleeding. There may be some injury to the cervix sometimes, and also sometimes there may be the rupture of bag of membranes around the baby, because of which there will be leakage of water. But this is very unlikely when the procedure is done in an elective manner and between 14 to 24 weeks, that is in the earlier period. And at that time, it's unlikely that this may happen. Let me tell you some of the contraindications for doing the procedure. So first of all, if there is a lot of infection, in that case we avoid this procedure because it may further aggravate the infection. Second, when already there is leakage of water around the baby, in that case we may not be able to prolong the procedure. It may lead to added up infection for the mother. In that case also we don't do the procedure. And next, in case if the patient is already in pain, she's in labor and the cervix has completely opened up, in that case also we cannot stitch on the cervix because it can tear the cervix and it may not prevent the patient from going into labor. And another thing is that if the baby is having any gross anomaly, any lethal anomaly, where on the scan that you have found that the baby is having any heart defects or kidney defects or any signs of mental retardation, in that case also we do not put a cervical stitch. So I hope today I was clear in explaining about this condition. In case if you have any doubts, you can reach us directly. You can come to us and visit us, and we can talk about this in detail.